Dr. Colin Gunling from Alliance Physical Therapy, here to talk about blood flow restriction training. So we use this oftentimes in physical therapy when our primary goal is to grow muscle strength. It's a really good shortcut to growing more muscle strength, and we do that by actually occluding 40 to 80% of the blood flow to the limb that we're working on. So in this case, you can see Sarah has the cuff around her thigh, and we're working on lower leg strength. The goals of this is to restrict blood flow return from that limb, which will promote things such as type 2 muscle fiber recruitment, which are the fast muscle fibers. It will also stimulate a systemic increase in human growth hormone. And because of those factors and the fatigue that it causes, it has actually been found to definitely work on the muscles below where things are occluded, but it also helps work on the muscles above. So it works, we can use this in cases of hip issues. By placing it here, we can help them recruit their hip muscles even more. So in Sarah's case, we're focusing on working on the lower limb. So Sarah, we're gonna go ahead and have you do a few repetitions here. Just do like 10 repetitions up and down. So she's doing calf raises on the leg press here. And as she goes, we're focusing on slow, controlled movements. And the typical sequence is we'll do 30 repetitions, then a 30-second break, 15 repetitions with 30-second breaks in between each one. We'll do that 3 times. And typically by the end, they're feeling extremely fatigued in that muscle. Sarah, as you go, like, how does this feel?
It gets harder as I go, and it makes it harder to recover throughout the sets.
Yeah. So, and that's a pretty typical thing that we'll hear from patients, that recovery just isn't there as much. So we'll go through that sequence with her, and we may add another exercise onto that as well. And when she's all done, we'll release that pressure, and we'll continue through the exercise. We can typically see significant gains in strength in like 3 weeks with this, where typically it takes 4 to 6 weeks to see these gains in strength. So it's a really effective tool for post-operative and in cases where the joint doesn't tolerate a lot of stress. So it's used for athletes to get more strength for performance, but it's also used for those individuals with arthritis in the joints where it's hard and painful to put stress through the joint. So we can take stress off of the joint by loading it less with the BFR and increasing stress through the muscle more. And that's another important thing to note. With blood flow restriction, we can load the muscle at 30% of its 1 repetition maximum, and have the same gains in muscle strength as loading it at 80% of its 1 repetition maximum without any restriction. So that's the benefit when we're dealing with someone that has pain in the knee because of arthritis. We can put less load through the knee joint and same amount of load through the muscle tissue and get those same muscle strength gains, which strength is really important for supporting joints. So with blood flow restriction, that's another service that we offer at Alliance Physical Therapy. Thanks. So I wanted to take an opportunity to show you some of the different cuffs and how these cuffs would specifically work on the individual patients. We have 4 different cuffs here for just limb size. So typically we'll use the blue or the yellow cuff for the lower body, and then the red or the green cuff for the upper body. What we will do is give it to the individual, have them, if it's a lower body, have them put it as high as they can on their leg, and then Velcro it, and then we'll take and Velcro it pretty tight, and we're going to take the pump and attach it much like a blood pressure cuff. We're going to pump it up. After it's pumped up, we will use a Doppler, which is going to help us understand how much blood flow is flowing through the system, and we'll ensure that we have an appropriate amount of blood flow for the limb before we take it off and start to exercise. We definitely don't want to occlude the limb entirely, but we want to partially occlude the blood flow from the limb in order to get the strength gains that we're interested in. This is definitely going to be something that's going to feel very fatiguing for the individual as we go through the system, but we don't want it to be painful. So those are some key ideas that we've got to keep in mind when we're using the blood flow restriction therapy, and to ensure that it's safe for the patient, but also it's giving us the improvements that we're interested in.